What supplement should you be taking if you're suffering from joint osteoarthritis? Here's my current recommendation for you. This is from Solgar. It's a glucosamine, hyaluronic acid, chondroitin, and MSM formula that Solgar produces. This is my current best recommendation. In this video, I'm going to break down what each of these components does, why it's important for your joints, and I'll tell you why it might be helpful for you to start using if you suffer from osteoarthritis in your joints. So let's talk about the first part, glucosamine. Glucosamine is an important component that's used in the development of cartilage in your body, as well as the fluid that nourishes it, the joint fluid called synovial fluid. It's got glucosamine in it. Taking this supplement might help you to preserve your cartilage and even heal damaged cartilage in joints. Now, usually glucosamine is made from shellfish, things like oysters, crab, and shrimp, but this formula is actually shellfish free. So if you have any allergies to that, that's a huge plus. Now, Solgar actually makes this gluten, wheat, and dairy free as well. So this is like the ultimate hypoallergenic osteoarthritis joint supplement that you can find out there. Now let me tell you about chondroitin. Chondroitin is also used in the development of cartilage, and you can also find it in the synovial fluid, that joint fluid. So paired together with glucosamine, it just makes sense that you would take a supplement for the two. These two components are built into the molecular structure of cartilage tissue, so they're critical for your cartilage health. There is research to show that glucosamine and chondroitin together can help with preventing the breakdown of cartilage tissue. Now, I'll speak more to that at the end when I give you my honest opinion about using this product, because there's a few details that I want to cover so you can make sure you have the real information. Now, there's a few details that I'll speak more to about at the end of this video regarding the research for these products, but I want to give you the full details so that you have full transparency, but make sure you watch the end of the video. Right now, I'm just covering each molecule. Now, let's talk about hyaluronic acid. The names are going to start getting crazy now. Hyaluronic acid is commonly found in our tissues that have connective tissue, the collagen specifically, which cartilage tissue is high in connective tissue and collagen. So hyaluronic acid is a super important part of that structure. Now, it's also found in the synovial fluid, the joint fluid that feeds, that nourishes the cartilage inside your joints. And we're starting to see hyaluronic acid infused in all different kinds of products out there, including skin products, because we're seeing that it's of benefit to connective tissue even in our skin. Now, that joint fluid, that hyaluronic acid is very commonly found in abundance. It helps to lubricate the joints to give you more flexibility. The better lubrication you have in your joints, that means the healthier your synovial fluid is, which it's influenced by hyaluronic acid, then you should theoretically have more flexibility, more lubrication in your joints. There's even a movement out there of hyaluronic acid injections. It's often called a hyaluronic gel injection for knee osteoarthritis. There are companies out there that are making hyaluronic acid gel injections that can be put into knee joints that are intended to provide a little more cushion by adding more fluid, but also to help nourish the cartilage in there so that you can help to prevent the breakdown and improve the overall health of the cartilage that's being damaged by osteoarthritis. Now let's talk about MSM. I want to get the name right, so I'm going to read it off my screen here. MSM is short for methyl sulfonylmethane. Mouthful. But what you need to know about MSM is that it's an anti-inflammatory or an antioxidant in our bodies, meaning it helps to take free radicals out of our bodies. Just so you know about free radicals, they're particles or molecules that destroy our cells at the molecular level, and you want to get rid of those in your body as much as possible. They're usually part of waste products that are developed as the normal cell processes are happening. But the more antioxidants or anti-inflammatories you can have in your body, like MSM, what's in this here, it can help to catch those free radicals and help get them out of your body. You know, you eliminate them through your normal elimination pathways that your body has. MSM has been especially focused on being used for joint arthritis. So in addition to its anti-inflammatory and antioxidant properties because of the sulfur molecule that's inside the MSM molecule, It's got special use for joint inflammation, joint arthritis situations. So it just makes sense to pair it along with glucosamine, hyaluronic acid, and chondroitin in this formula. So let me give you my honest physical therapist's opinion about Solgar's joint supplement. I really like this. I think it's the best I've seen yet. The formulation is fantastic, including all 4 of these, because oftentimes when you go look for joint supplements, you just find glucosamine and chondroitin. They're starting to add MSM a bit more, but hyaluronic acid, I haven't seen that together paired with the other 3. Solgar has been around for 75 years, so I think they know how to do vitamins. I think that's pretty awesome. And they package their pills. Every single supplement that I've got from them is in a glass amber container. So you can hear this. This is glass. It's not plastic. And to me, that just is going the extra mile, because plastic is known to leach components off of it that can, cause some harmful stuff, things like cancer. Glass is a much safer option. And I think they're doing it right. It might be a little bit more, but if it's your health on the line, I'll pay those extra few dollars to make sure that I get the best products out there in my body to help my health and avoid unnecessary surgeries, injections, and pain medications. The other factor where they're just going the extra mile is that they've made this as hypoallergenic as possible. I mean, shellfish free. You rarely ever see that when it comes to glucosamine and chondroitin. And then even gluten-free, wheat-free, and dairy-free. I have a dairy allergy, and sometimes I get a wheat allergy as well. So I appreciate that they went that extra mile so I can have confidence that I'm taking something that's rarely ever going to cause any sort of allergies. Now, speaking of allergies, that's a situation that you might not want to take this. When we're talking about contraindications or reasons to avoid taking this, if you take this and it's causing some immediate reaction like on your skin, or you just feel sick or nauseous, you need to stop taking it. There might be something else that you're allergic to that it's super rare and they haven't accounted for. You also want to be checking with your doctor if you take blood thinners or if you're pregnant or nursing. Now, I have not seen any restrictions on age relating to this, but you do want to be careful to keep this away from youngsters that might choke on these, because these are a choking hazard. I haven't opened this new bottle, but you can see it comes sealed, and it had a shrink wrap around it as well. But it says on the bottle to avoid having it around kids, but I really don't think it's because the product itself, the chondroitin, glucosamine, hyaluronic acid, MSM is harmful. It's just that these things are big pills and a kid could easily choke on them. Now, let me tell you how to use this. So on the bottle, it says to take 3 per day, ideally with the meal. I recommend taking it with the meal. We'll just get digested easier. And so you just pour 3 of these out, and that's what you would take per day. Now, what I have seen based on the research is that if you just take these 3 once, or even just do it a few days in a row, it's not enough to have the effect that you're looking for in your joints. You need to commit to taking this supplement for at least 2 months. So we're talking 60 days. Now, one of these bottles has 120 tablets. So if you're taking 3 per day, that's 40 days worth of the joint supplement. So you're going to want to get 2 of these bottles to put this to the test and make sure that this experiment works for you. The other thing about this, to give you my full transparency, is what I was talking about earlier in the video, is you can't take this alone and expect your knee arthritis or your back arthritis or hip arthritis, hand or shoulder, wherever else you have arthritis in your body, you can't expect it to improve with just this alone. Now, it might improve to a degree. You might get like a 10, 20, 30% improvement, and that's great. But arthritis is rarely ever simply a supplement problem. Like, you're not getting enough of these components, and if you simply take that, it's going to cure your arthritis. There's always a mechanical component, meaning you need to exercise correctly and fix the muscle imbalance that's causing too much pressure in your joints. That's what's setting up your arthritis problem. If you can fix that, then you're going to solve your arthritis problem for the long term. This can be used to complement it so that you're setting the environment within your body in an optimal situation for you to now do the mechanical corrections as well as the nutritional supplemental corrections. Both of those combined can complement each other. So I highly recommend you get something like this and start putting it to the test. Give it a solid 2 months, 60 days plus. before you decide whether or not you're going to stop taking this. Now, if you do start taking this, if your arthritis is advanced, like if you're in stage 2, 3, or 4 or beyond, you might say, you know what, I'm going to put this on the regular shopping list and make sure I have it in stock so that I can always be taking it along with my meal every breakfast time or whenever you decide to eat, because it is so important for you to keep your joint health as good as possible as you age, so that you can avoid those surgeries, injections, and having to rely on pain medications that are harmful to your organs. If you want to get this from Amazon, that's where I got it from. There's a link down in the description below to purchase this on Amazon. And I've also included there some links to some of our best videos for hip arthritis and knee arthritis. So you can go find the playlist for that below, as well as our knee arthritis recovery program. If you want to learn more about that, there's a link in the description below. Thanks so much for watching, and I'll catch you in the next video. Bye-bye.